Welcome to your weekly checkup with Dr. Lazar and Jaden Lazar. Great to be with you tonight. We are talking about migraines, and we have got a great show for you. So, our number tonight is 866-521-WELL, 866-521-9355. We're taking your calls live, and we are thrilled to be able to share this info. So, there's a girl named Shauna. She was 17 years old. Her mom brought her into the office. She had heard from several people to bring her in, and she brought her in at 17. The problem is Shauna was diagnosed with a condition. She had a Arnold-Chiari malformation. So she had the back part of her brain was coming down out of the skull, like down through the skull. And that's a problem. And so they did surgery where they tucked that back up into her skull when she was 7 years old. And when she woke up from that, she had a migraine headache that she hadn't had before. Now, the reason she went in for help was because she was having body temperature regulation issues. And they said, well, this is why. And so we're going to fix it with that. So she woke up and had this migraine, and the problem is the migraine didn't go away. So it's not like she had migraines for, 10 years. She had a migraine for 10 years. And if you've ever dealt with migraines, I mean, to deal with something that painful, that debilitating, for that long, it's just, I can't even imagine. So she had been everywhere and done everything. And she finally came in. I got her adjusted on a Friday. I'll never forget. And I was like, she had some weird stuff on her x-rays, and I got her adjusted. And then Monday, her mom called the office, and my team came and got me, and they said, you need to take this call. So I took the call, and her mom, Jennifer, was just sobbing. You know, when you're crying and and you can't like get any words out. So that's what her mom was doing. And I didn't know what was wrong at this point. And I asked her, calm down, what's going on? And she said to me, Shayna, like that. She couldn't talk really. But she said Shayna hasn't had a headache in 3 days.
Wow.
It was
3 days.
So cool. That was the first time in 10 years that she didn't have a headache. And so that was powerful. She ended up going back to school and graduated with her high school.
Wow.
And went to college, and then went to chiropractic school. And she practices in Northern California now. And that's one of so many stories. I mean, it's mind-blowing. There are a lot of things people can do for migraines, or they think they can. And so we're going to answer some of those questions tonight. We're going to answer any questions you have. Our number is 866-521-WELL, 866-521-9355. Jaden, what's a question that you've heard? I know you're involved in some moms groups and things like that. And when people talk to you about migraine, they'll ask for...
A lot of times people will ask, what can I do? Because the main thing you hear is medicine, Tylenol, Excedrin, ibuprofen, aspirin. And those are over-the-counter medications that you can get. But if your headaches are really bad, sometimes you'll be prescribed a stronger medication.
Okay.
And one of the things that I hear a lot is, I am a mom. I don't have time for headaches. I don't have time to get better if I do have a headache, that I just need to still focus on and help and take care of my kids. Or if I'm taking the medicine, I have these side effects that I'm not a fan of, and right. I'm not as hungry, or I'm losing weight, or they're side effects that take away from them being able to just focus on their kids. And I always tell them, just come on into the office and we'll see if there's some pressure on your brainstem that's causing those headaches. And, it could be something as simple as stress. There's a lot of different reasons for headaches, but we see a lot of people with headaches that they don't have headaches anymore.
Big time. Big time. That's huge. We get a lot of questions about what moms can do, pregnant mothers can do with migraines, because, the big question is this going to hurt my baby? I mean, which is a perfectly appropriate question you should be asking.
Yeah. With me, I was told Tylenol is the safest. But I always felt like, is this just because it's the safest of all the options? Is it actually safe?
Right.
For my kid? And even some of the other medications that were prescribed, they say, oh, this is safe in pregnancy. And there was research I did that said otherwise, for specific medications. And so I was like, let me think about this. One person is told one thing. They think they're helping you. They tell you this information to help you feel better. But it's not the current case, because stuff is changing all the time.
Yeah, that's true.
So
that's very true. So, yeah, I mean, moms don't want to take medications that would potentially harm their baby. Some people will get injections. They'll get Botox injections in the head. That's botulinum toxin. So
it's usually in their forehead.
Yeah.
Around their eyebrows.
To try to relax that. And what we found is if your problem is from pressure on your brainstem, that's a mechanical problem. If it's restricting blood flow, that's a blood flow problem. And the thing that we find with that is you can't out-medicate a chemical or a neurological or a structural problem. It can't be done. You can't chemically alter and fix. You can change the symptoms for sure, but you can't chemically alter and fix migraine headaches. It doesn't work that way. So the question is, what do we do about it? Are we just stuck, or what's the deal? Do we have to deal with it? Pregnancy is a big one. Also, kids. We see a ton of kids with juvenile or pediatric migraines. And that's a big indicator that stuff's going on with the nervous system.
I think a lot of what I have observed with children and teens who have headaches has to do with if they're on any medication for anxiety, depression, ADHD, you name it. A common side effect of a lot of those medications that are maybe helping them with their attention span disorder or whatever they're dealing with, but is then causing them headaches or depression or both or several other things. And then the parents are thinking, okay, I'm trying to help my kid. This is getting better, but this is getting worse.
Right.
How am I able to help and fix this problem that my kid is dealing with? I don't want them to deal with any of this.
Right.
So
that's appropriate. I mean, you're absolutely correct with that. And that's a big deal. Irvin online says, good evening, y'all. Good evening, Irvin.
Hi.
Great to see you on here. Thanks for watching or listening. I guess you're watching if you're commenting online. Mm-hmm. So the issue with migraines is, are you going to be stuck in a dark room for several days a week? You know what blows my mind, Jaden? The number of people who say, it's not that bad. Like moms especially, they'll have that mom syndrome where it's about everybody else and not them. And it's so crazy to me. They'll say, well, I'm only getting them. It used to be every day. Now it's only 3 days a week. So it's not that bad.
Yeah, that we hear that quite often. And to me, I notice I get a headache if, I eat something that is not good for my body. But other than that, if I get a headache, my first thought growing up under chiropractic care is, okay, did I sleep funny? Did I do something to, um, I'm trying to think of the best way to say it. My first thought was put myself out of alignment. That's what we talk about in the office. If you're in or out of alignment, that means is your body working properly with your nervous system and everything like that. So that is my first thought. And I usually, Dad, can you adjust me? Can you fix it? But for a lot of people who have not grown up under chiropractic care or just don't know about it, even, it's very common, but it's not supposed to be.
Right. Yeah, that's well said. Common doesn't mean normal.
Right.
And it doesn't mean it's okay. The number of questions we get, I don't know what the word is. Like, it's not funny. I guess it's interesting that almost every question I get that people will send in it will name the age of a kid. So it's not like just for kids. That'll say,
my 7-year-old son.
Yeah, migraine treatment. We don't treat migraines, but that's what people ask for an 8-year-old, for a 16-year-old, for a 10-year-old. I'm actually looking at a list of questions that we get right here for a 6-year-old, 5-year-old, 9-year-old, 11-year-old, 15-year-old. Parents are asking questions with the specific age of their kid. That's a lot. I mean, it's one thing to ask about kids, but parents, hear me. Headaches in anybody are not okay. You definitely do not need to tolerate that. It can be from really benign things like dehydration or something along those lines. But if your kiddo is having a migraine or headaches of any kind repeatedly, that's a warning that there's something going on underneath. And that really, really needs to be addressed.
And it takes a lot for the body to show a symptom. So just because they started having headaches this week, that means there have been months or even years of interference with the nervous system, and you're just now finally seeing that.
Yeah, that's a good point, Jaden, because it can take 7 to 10 years before a symptom will show up, with the nervous system. So it's a big deal, and we're here for you. We're taking your calls, 866-521-WELL, 866-521-9355. We're going to take a short break, but before we do that, Jaden, would you tell our awesome listeners what they can expect if they come in to the office and what they get for being WMUZ listeners?
Yes. So in our office, a new patient consultation costs $224. That's where you sit down, you have a detailed conversation with the doctor about what's going on. And we also include a posture check. It's a special device. There's only a couple in the world, and the guy who made them actually passed away. So we're currently in the process of designing new ones. Dr. Friedman is doing that. Shout out to Dr. Friedman.
What's up, Dr. Friedman?
But all that to say, it's super specific, and that we include as well in your consultation to get some specific numbers to talk with you a little bit about what's going on. All that to say, that's normally $224. And if you mention when you call the office or our number on here, 866-521-9355, if you mention that you're calling from the radio, that will be no charge to you. So $0. You'll save
consultation.
$224 for the consultation.
Got it. Okay. Very cool. All right. We're going to take a short break. We'll be back. We'll take your calls and questions live right after this. Welcome back to your weekly checkup. I'm Dr. Lazar. I've got Jaden with me. She's rocking it out tonight.
Thank you.
And we're having a great time, as always, talking about people with migraines. All right, let's take a comment here from the interwebs. Janelle said, suffered from migraines from age 14 into my 50s.
Wow.
When I combined good chiropractic care and cleaned up my nutrition, it dramatically reduced them over the past year and a half. Great job, Janelle. That's what we're talking about. Now have to rarely take medication for them now. That's fantastic. We had a guy named Chris that was in, and I asked him how he was doing. He said, I'm doing great. I'm doing well. And I said, that's cool. He said, but I said, are you feeling any better? He said, I don't think anything's any different. Well, when somebody comes in with migraines and then says, I don't think I have anything different going, that kind of, to me at least, implies that you're still dealing with the migraines. And it was one of the funniest things. This happens all the time. People are busy and they don't pay much attention to it. But he said, my memory is getting worse. And I said, your memory? Okay, what's going on with that? And he said, the other day I was leaving for a work trip and I couldn't find my Imitrex. And I said, Chris, Imitrex is for migraines. If you can't find your Imitrex, that means you haven't been taking it. Right? I mean,
yeah.
And he said, yeah, you know what? I guess you're right. I said, okay, so you haven't been taking the Imitrex and you're not noticing migraines? And he was like, oh, I guess I'm not. Listen, Linda, that's a very common thing for guys to do. Like when I first was exposed to this work in 2004, or the precursor to this work in 2004, a colleague took the pressure off my brainstem. It was a very gentle adjustment. In fact, I thought I was getting ripped off because it was so gentle. I didn't think she was doing anything. Anyway, I was in the hospital earlier that morning with bronchitis and pneumonia, and my wife called me that afternoon and asked how I was doing, and I was studying. And I said, how am I doing? I'm fine. Why? And she said, well, weren't you in the hospital this morning? And I said, oh, yeah, I was. That's true. And she said, well, so how are you doing now? And it didn't even dawn on me that I wasn't coughing. I didn't have this horrific migraine headache that felt like an ice pick going through my eyeballs. I didn't have that anymore. And I didn't realize it. Lest we forget. I guess I was just busy and preoccupied. You think that's a guy thing?
No. Well, yes and no.
Yes and no.
I see that a lot at the office when I'm putting in notes for the doctors after I take measurements, and I'll ask our patients, I'll say, Is there anything you'd like me to put in the notes for the doctor? Any questions you have or anything you want them to know? And they'll say, no, I feel great. And I say, okay. And then I say, okay, so-and-so. We talked about last time your knee, you couldn't bend your knee at all. How's that working? Oh, no problems with it, actually. I forgot about that.
Yeah, that's
so
true.
it's really common. Yeah, it's very common.
So it's not a guy thing.
I notice it more in guys.
I don't know. All right. So if you deal with migraines, if you have somebody you love that deals with migraines, I would really, really encourage you. I'd make you, if I could, come in for a nerve scan. We have technology in the office that measures the nervous system, and that's really important because without measuring it, we don't have any idea what's happening. You can't change what you don't measure. And so we can find out whether there's pressure on the brainstem. We can see how the nerves are that control blood vessels, which is a huge connection with headaches. And it's really, really, really helpful. Now, a lot of times people they'll say, well, I've got blood pressure issues and migraines. And those are both under neurological control. The number of times somebody's come in for headaches, hasn't said anything about migraines. Hasn't said anything about high blood pressure. And then we get them adjusted, get the nervous system functioning the way it was designed to function. And what do they report?
Their blood pressure was lower.
Yeah. So the migraines go away and the blood pressure is lower.
Well, that's obviously not related, though.
They must have started drinking water.
Probably.
So the idea is, think about that. That is a regulation issue. Blood pressure is a highly regulated function in the body. So is blood flow through the vessels in the head. And if that regulatory system, the nervous system that is in charge of all that, if it's not functioning properly, then blood flow is not going to be right. Blood pressure is not going to be right. There was a study in the Journal of Human Hypertension out of, what's the college in Chicago? Rush, the medical center, the cardiology department, George Bacris, they're pretty well-known research cardiologist. And he noticed there was this number of patients that were coming in and their blood pressure was lower, but he hadn't changed anything. And so, it would stand out to him and he said, what are you doing differently? And they said nothing. And he said, well, something is different. He started tracking it. They all ended up starting care with this upper cervical chiropractor where, you work in the upper neck. And they're like, there's no way that has anything to do with any of this is what they were saying. But they ended up doing a study to test it because in it almost, you're not supposed to start a study with this strong of a bias, but they almost did it to disprove that could be what was happening. And they did the study and they found that on average, one adjustment, one correction, one reduction in the misalignment at the bone right where your earlobes are would lower systolic blood pressure, the top number of blood pressure, on average 17 points, and it would stay down for 8 weeks with one adjustment.
Wow.
It's fascinating. There was another study done. This one was so cool to me. So this guy in Philadelphia, he's got these horrible, horrible headaches, and he's going in for neurosurgery. He's done everything else, and he said, okay, the surgeon can do surgery on my neck. And it was something different. I think it was like a microvascular decompression or something. It wasn't approved by the FDA or anything. So this guy was going to pay, it's like $60,000 for this test treatment. But he was suffering really bad with these migraines. And so they did a phase contrast MRA. We've heard of MRIs, magnetic resonance imaging. MRA is magnetic resonance angiography or angiogram, where they're using magnetic resonance to look at the blood vessels and the flow of blood through those vessels. So he had this done and they tracked it. He goes to, I think, home to Chicago or something. Of course, goes to see this upper cervical chiropractor, it's a really precise adjustment. It's like tuning a Steinway piano. And he got an adjustment and his migraines went away. So he goes back to the neurosurgeon and said, "Hey, I know you're planning on doing surgery, but my migraine, it went away." And he said, "Well, that happens from time to time. We still need to do the surgery." And he said, "Well, so I saw this chiropractor," and he said, "You saw a chiropractor?" And the guy said, "Yeah." He said, "Did you let him adjust your neck?" And the guy said, "Yeah." And it now the neurosurgeon is thinking about this high velocity,
a traditional forceful,
neck cracking thing. And so that made him nervous. He didn't know it was a specialist type adjustment. But he said, "Look, I'm not doing surgery on you again. We have to, until we do a phase contrast MRA again, another angiogram." And it was $12,000 for each of these scans. And the guy had to pay for it because he went and did something different. And the surgeon said, "I'm not doing surgery on you. If you just move structures around there, or somebody did, there's no way." So he has another angiogram and noticed that the jugular vein blood flow had balanced out on each side. So they looked at the before scan, then the after scan. Before scan, migraine; after scan, no migraine. The difference was an upper cervical correction. And then, I don't know, 8 weeks later, 6 weeks later, something like that, the migraine starts to come back. So now the neurosurgeon's like, "Okay, wait a minute." So they do another scan, another phase contrast MRA, and see that the jugular vein, it's called stasis on the side, where it wasn't flowing properly. It was getting like stagnant on one side. So then the guy's like, "I'm going to go back to Chicago and have this thing done." The thing was this adjustment. "And I'm going to do that and see." So he goes back to Chicago from Philadelphia or Pittsburgh, gets another adjustment. Headache goes away. He comes back. They do another scan. They're like, "There's no way." This is his fourth phase contrast MRA. I have pictures of it. In fact, it's on the screens in our office. I actually have pictures from this study on the screens. And after the adjustment, the blood flow was normalized again. So it's a really, really, really powerful thing, guys. These types of adjustments, they're not treatments for migraines. They're not treatments for trigeminal neuralgia. They're not treatments for hypertension. It's all about finding a lot of times people say the source of the problem. Really, we're not even as interested in that as much as we are the source of health. And so we take a salutogenic approach where we're looking for where health comes from, and we believe the body wants to heal itself. We recognize and honor that a living organism will heal and regulate on its own. We don't have to think about it. We don't have to do stuff. It just does it on its own if it's allowed to, but it wants to. And so that's where the challenge comes in, because if we're doing things in a physiologically incompatible environment, like changing the chemistry, but not getting the pressure off the brainstem, it's never going to be a solution. Hey, we got to take a break. Our number is 866-521-WELL, 866-521-9355. Happy to take your calls on the air. Also, you can use that number throughout the week to be connected with our office in Ann Arbor. And if you're not from around here, we're happy to help you find somebody in your area. So we're going to take a short break. We'll be back right after this. Hey friends, online, we want to hop on here before we go back on. Welcome back to your weekly checkup. I'm Dr. Lazar. I've got Jaden is rocking it out tonight. Thanks for being here, Jaden. And we're talking about migraines. We've talked about having, kids having migraines and what can be done about that. And we've talked about pregnant women. We've talked about studies. We've talked about Shayna and Chris. It's really cool.
We have a mom who comes into our office, and her son recently had a pretty serious head injury in one of his sports.
Oh, yes.
And she called and said, "Oh my goodness, I'm so sorry. I can't make it to my appointment. I'm in the hospital with my son." And I said, "Oh my gosh, I hope everything's okay. No worries, we'll get you rescheduled." And then I said, somehow we got to talking about what happened, and she said that he had a serious head injury and that he couldn't see out of one of his eyes, and he had a headache immediately after this injury. And she said, we've been at the hospital all night, and he can't see, he has bruising and headaches, and he's nauseous, and she said surprisingly he doesn't have a concussion. And that was weird to me, that he didn't have a concussion but head trauma. Mm-hmm. And she said something about, we have so many tests, and I said, we need to get him in to the office as soon as possible to check for pressure on his brainstem before it becomes a permanent problem. And she said, "Oh, well, they'll probably tell us here because, he has an MRI and some CAT scans and some other stuff coming. So they'll figure that out and they'll let us know." And I said, all of those tests are important for the information that they're going to find. And I said, but what they're not going to test at the hospital is pressure on his brainstem and how his nervous system is working properly. I said, that's not a test that is done within the hospital. And I talked to her for a while, and I said, we have to get him in because that's not something they'll test for. And so I'm working with her on that right now. But I told her, I said, I can tell you honestly, with everything that I've learned and seen and observed in our office, there's no way outside of a miracle that he would not have severe pressure on his brainstem with a serious head injury that he has.
Well, that's, you know, people, that's a good point, Jaden, because people will get really obsessed about testing for concussion. And then they'll say, oh, he's not concussed. That's great.
Right.
But just because the brain didn't get jarred around doesn't mean that he doesn't have pressure on the brainstem.
Right.
That's the part that's missing. And of course, we say all the time, we miss 100% of what we're not looking for. And so that's got to be addressed because, and here, I guess the main point with that is, if there's a chance there's pressure on the brainstem, or regardless of what it is, if there's even the slightest chance that this might help him grow better, develop better, not have migraines, whatever, if there's even the smallest chance, do you think we should find out? That's it's, people really will say like, well, I don't know if that makes sense, or, you know, anything like that. And it's like, look, whether it makes sense or not, like, don't try to figure it out. We can literally test for it.
That's one of the questions I ask a lot of people if they're, I don't know, I should come in, or I always ask that. And something that people like to hear, that it doesn't feel like you're challenging them, but you're still respectfully sharing the knowledge that you have, is if you start a sentence with the way I see it.
Yeah, that's true.
Because if you start with the way I see it, you're not attacking their beliefs or their mindset or opinion or anything that they've already said to you.
That's a good point.
If you say the way I see it, you're acknowledging that you've heard that they think different than you, and that's fine. That's okay. And then you're saying the way I see it, fill in the blank. Then that's showing you listen to them. You have a different solution than they have. And that gives them all the information without feeling like you're attacking them. So they can honestly hear the information that you're giving to them.
Yeah, that's true. That's a great way to do it. Yeah, back in the old days, people could disagree and still get along. It was weird. Laura online says, I pray for anyone out there that gets migraines. Thank you for that, Laura. And she also said, I get headaches, but never migraines. Well, headaches aren't good, but it's good that you don't get migraines. A lot of people ask me if acupuncture will help with migraines. I hear it does. I've not studied acupuncture. I've had it done. I've got some people that I know, like, and trust, and you know, they say good things, which is cool. We also know that blood flow regulation is an issue. So in our office, we can address blood flow two different ways. One of them is the neurological side of it. The nervous system, the autonomic nervous system, controls how blood vessels open and close. It's called vasomotor control. I don't know that anybody cares about that. But if one of you out there is a science nerd,
this is for you.
It's called vasomotor control. And so we can address the blood flow issues neurologically. We also have a device that it's a very, very cool device. It's been connected with NASA, and it's very, very cool. And Jaden, you handle a lot of that in the office for us. So what's up with that device? What is it, and how could it potentially help with blood flow, which could then indirectly help with headaches?
Yes, so the device Dr. Lazar is talking about is called Beamer. It was originally, and Dr. Lazar, you can correct me if I'm wrong, originally used in, not in our country. It started outside.
Liechtenstein,
yes,
is where it's developed. Yep.
I couldn't think of the place. But it was used for horses and people as well, but a little bit different. Anyway.
Yes, horses and people are different.
But it improves blood flow and circulation, which is getting blood blood flow, there's oxygen in your blood.
Right.
And so when you have better blood flow and circulation, your body is getting more oxygen. And so when you use this device, I could talk so much about this device. I honestly feel like it helps with everything. Just getting the more oxygen, blood flow, circulation, all of that working properly. It helps me personally with headaches. Sometimes my hands and feet get cold. And so with the better blood flow, my hands and feet aren't as cold. Mm-hmm. They're warmer. I don't feel like my brain is as foggy, if that makes sense. It's the word I'm thinking of right now. But and it's not long. It's not painful. The normal setting is only 8 minutes.
Yeah. What's interesting, you said you feel like it helps a lot. Here's what's super cool. So the reason we exist is to help people realize and express their full God-given potential. And so we believe that if you are dealing with health issues and that's holding you back, then you're not living out your full God-given potential. We believe the world deserves you at your best. And for those of you that believe that and align with that, this will make a lot of sense. So when somebody says, can these migraines help, can migraines be helped with chiropractic, right? They'll ask symptom, then what they call treatment. None of this is a treatment, but can it help with migraines? Can it help with autism? Can it help with trigeminal neuralgia? Can it help with cancer? And my answer to those is, if you were dealing with migraines or autism or whatever else I mentioned, would you want to have an optimally functioning nervous system or a nervous system with interference?
Good question.
That's it, and so better nerve flow, better flow of information over the nervous system will only help. Will it take away the migraines? Usually, but not always, and it's not a treatment. It's about better nerve flow. So to your point, Jaden, what will better nerve flow help?
Everything.
What will better blood flow help?
Everything.
And what will stem cells help?
Also everything.
So that's the thing, we don't ever want to paint the picture that we actually don't fix anything other than subluxations, restricted blood flow, and poorly activated stem cells. Mm-hmm. The beauty in those is that we remove the interference, allow whatever needs to flow, nerve, blood vessel, or nerve, blood, stem cell. Nerve is most important. Mm-hmm. The other help for function. If blood flow is extremely important, but it's very unusual that you would have completely cut off blood flow to an area, is what I'm saying. So if those are all flowing, your body can work the way it was designed to work. And remember, the body wants to heal. Laura online asked a question: why do I get headaches before my menstrual cycle? Very good question, Laura. That's very common to happen. And the main reason for that is because the easy answer is because of hormone fluctuations. When hormone levels change, that can affect other things like blood flow, inflammation.
It's an abrupt change as well.
Yeah, that's true. So the question is, are hormones being regulated properly? And the way we would know that is if your nervous system is functioning properly, because that's what regulates it. And so we would check that, and it's amazing what happens. Hormone levels balance out. Ladies with painful or irregular menstrual cycles, that gets a lot better, and headaches get a lot better because,
helps
again,
with infertility as well.
Yeah, that's true. That's true. We had a guy one time, gosh, I had only been in practice for a minute, and he came in 6 or 8 weeks after his wife started care, and he was sitting in the lobby, and I just kind of waved. The rooms, you guys don't let me hang out up front. My rooms are 30 feet back at the back of the building, so I don't get distracted and start talking to people. And anyway, I saw him and waved at him, and he yells. The whole reception area was super full. There weren't enough chairs, standing room only. And he yells back to me, "Hey, Doc, good to see you. You got my wife pregnant." Can you imagine? I said, so at that point, I had to go out front and say, I only adjusted her. I thought that was an important distinction. It's true.
But you removed the interference from her body.
Yeah.
So that she was able to get pregnant.
For sure. The power that made the body heals the body.
Dr. Lazar, can you, small subject change, can you explain the difference between a migraine and a headache?
Yeah. Migraines, there are different types of migraines, and that's a good question, Jaden, and I get that one a lot. What I want to point out before I answer the question is what it's called doesn't really matter. Mm-hmm. Now, that will make people's skin crawl. Any other physicians listening, diagnosticians will be like, that's the dumbest thing I've ever heard. Here's why what it's called doesn't matter to us. Because we don't have a protocol to treat something, any symptom you have. Our protocol is meticulously scan the nervous system. We're best in world at that. I'm not saying that with hyperbole. I'm saying we have the best equipment in the world to check that. So we can tell whether something like that is going on. So typically with a migraine, interestingly enough, migraines don't have to have a headache involved with them. A lot of times they do, but they don't have to. Migraines usually involve some sort of aura, like kind of a weird sensation. Think like deja vu. It's not the same thing, but it's interesting. It's similar. So some kind of weird sensation or premonition or something. Now, again, they can be atypical migraines that don't have that. So there are a bunch of different ones. Headache is simply pain in the head. A migraine can involve a headache, but you can have visual migraines where you lose visual acuity. You can have migraines that affect your speech, migraines that affect your stomach, and the connection there is that the vagus nerve, which runs out of the brain and right down here on the left side below the ear, the connection there is with that vagus nerve. So what happens is both are under the control of the nervous system. So whether you have headaches, whether you have migraines, whether you have both, your body has the right to have more than one thing going on. All of that is a sign that, that the nervous system's going on. Sorry, I'm getting really cool comments, and it's like a squirrel, is running by me. So Paul online said, I've had my Beamer for 5 years and use it morning and night. Yep. Twice a day is best. Better blood flow is important. That and weekly adjustments from Dr. Lazar give me energy for life. That's awesome, Paul. Thank you for sharing that. Yeah. Like we love being behind the people that are doing stuff effectively so that they can fulfill what God's called them to do. So they're not being held back. Janelle online said, I get ocular migraines. I said visual. I should have said ocular, because that is a more accurate title of it. But sometimes visual will connect better with listeners. Flashing lights in your vision. Yeah. So ocular migraines, Janelle, those are common. Unfortunately, they can be really debilitating, as I mean, I know you know that, but we're sharing also with people that are listening. And so the connection between an ocular migraine, with the visual changes, and Janelle, I don't know whether yours involves head pain or not, doesn't always, so yours may or may not, but if it involves head pain and the vision changes and the flashes of light and the flickers, both of those are controlled by the nervous system. You might notice a theme or a trend is that the nerves control blood vessels. The optic nerve also controls how the eye work. And there's more than that, but those are both neurological, which is cool. We have to take another break.
Okay.
This is so fun though. I don't like stopping, but anyway, we have to take a break. All right. 866-521-WELL, 866-521-9355. Our online crowd is rocking it, man. They are sending in some really cool comments and questions and stuff. So big shout out to all our online peeps. Thank you for watching. We appreciate that. All right. We'll be back right after this. Hey, what's up, online friends? Jaden and I want to send a shout out. You just got caught talking crap right before I came on. Anyway, appreciate you guys being on, and we're going to go live here in just a second. 9355-866-521-WELL for your weekly checkup. That timing's interesting. Be on the radio. There's another promo. Okay. So, anyway, here we go. Welcome back to your weekly checkup. We were having a little shout out with our online friends. If you're watching online, make sure, let us know where you're from. We always like to know where people are from when we're on there. Laura online said, my mom had a friend that uses a Beamer. I tried it a long time ago. That was the first time using a Beamer. That really is fantastic. So I don't like to give you guys multiple things to do because then it just is confusing. But our number 866-521-WELL, you can call that to schedule a consultation. It's the best call you'll make. And again, if you're not in the area, we can help you find somebody who can. Now, the average upper cervical patient, the patient that sees an upper cervical specialist, the average patient drives 150 miles. So when I say not in our area, I don't mean, I'm saying if you have family in Texas or, wherever, we can help you find, some chiropractors specialize in sports stuff and some in personal injury and some in nutrition, and all of those are great, but not everybody specializes in pediatrics and in the upper neck. And so we're happy to help you find people in your area or people's or your family or friends. All right, so let's see. Laura from Davisburg. That's cool. Janelle from Brighton. I drove through Brighton today, Janelle, with the thumbs up. Irving in Westland. I was in Westland. What day was that? Not too long ago. So I was in your neck of the woods too, Irvin. That's cool. All right, so we've talked migraines tonight. We've talked to some really cool people. We've heard some really cool stories. Oh, hold on. Let me find the right button for that. Just a minute. Let's see if this is... No, that's... Oh, here it is. I think I found it. Okay. I found it. Don't give me buttons. I will hit them. I will hit them. So anyway, 866-521-WELL, 866-521-9355. We can connect you with our office in Ann Arbor or an office in your area if you need. We also can answer questions. We can connect you with Jaden, connect you with help answering questions about Beamer, that sort of thing. Magnesium is, I get this question a lot. Magnesium, people ask if magnesium will help.
I took magnesium for headaches when I was pregnant.
Yeah, it can be very, very effective. That can be effective. The thing is, that's still not necessarily getting to the cause, but certainly helping that, or that can help. Man,
And
I've
it's
had
natural.
people. Yeah, that's helpful. Also, riboflavin, people have asked, and I've read a few things on that. I'm not saying whether it does or doesn't, because, I don't know that part yet. But I've seen them, man. People have told me they're prescribed antidepressants to help with migraines.
That's actually really common, and it does not make any sense to me.
Yeah, I don't know if they're doing an off-label prescription to address those, or if they're addressing depression or something and seeing, because sometimes they'll associate, head pain or chest pain or neck pain or face pain with, with depression and anxiety. So sometimes it's that. I've had people ask me about Benadryl, if they could take Benadryl for it. And keep in mind, we don't put anything into the body. Healing comes from the inside out. So we don't put anything in the body. We've got another question. Let's see. All right. We've got time for one more question before I get yelled at. Have you both ever heard of grounding mat? Yes, I have. And I hear good things. I don't know a whole lot about it, but I've heard some good things. Okay, we are out of time. Thank you guys so much for listening. 866-521-WELL, 866-521-9355. Thank you for listening about migraines. If you have friends or family, or if you're dealing with it, let's get you checked. Give us a call. We'll connect you with the right people, see if any of our doctors can help. On behalf of our team in Ann Arbor, our awesome team at WMUZ, thank you so much for listening. We'll be back next week.
God bless.
Okay, we are all set. We'll talk to you next week.
Awesome. Thanks, Anthony.
Yep, you got it. We'll see you.
All right. Online friends, thank you for being on. The show just finished up, so thank you for that.
I think it's more fun when it's live.
Well, yeah, because we can take questions and that sort of thing. All right, so online, thank you for checking it out. This will be podcast by Friday, I think, is when that goes up. yourweeklycheckup.com. Any questions throughout the week, make sure you send those in. And thanks for being here. You guys rock.